United Nations Convention on the Rights of the Child (CRC), ratified by Pakistan in 1990, is the most widely ratified human rights treaty ever. Article 19 of the CRC defines the right of a child to protection and provides the basis for establishing child protection systems to prevent and respond to abuse, violence, neglect, harmful practices such as child marriage and exploitation of children. The Sustainable Development Goal SDG 16.2 aims to end abuse, exploitation, trafficking and all forms of violence against and torture of children. Article 25(3) of Constitution of Pakistan calls for the state to make special provisions for the protection of women and children. And Article 35 obliges the state to protect the institution of marriage, the family, the mother and the child. Consequent to the 18th Constitutional Amendment, implementation of a coordinated child protection prevention and response system is a core responsibility of the provincial and territorial governments. The system should include legal, regulatory and policy framework, governance, structures with clear roles and responsibilities, child protection services for prevention and response, standard setting and oversight through accountability mechanisms, resources, human, financial, infrastructure, participation of children, adolescents, families and communities, data collection, management and monitoring systems. The Government of Gilgit-Baltistan has been tirelessly working towards establishing this system since 2017, when it went through a legal reform process to align the child protection legislation with CRC with UNICEF's technical support. Resultantly, the Gilgit-Baltistan Child Protection Response Act 2017 was enacted to holistically deal with every child in need of protection in the territory. UNICEF joined hands with child protection experts from Oxford Policy Management (OPM) and in collaboration with the Government of Gilgit-Baltistan initiated a flagship program on child protection, response and prevention systems, a groundbreaking initiative. The journey began with an inception workshop in March 2018 on child protection case management and referral system in Pakistan, with over 100 participants from across the country, including government officials, parliamentarians, UN agencies, civil society, global child protection experts and media. Thereafter, Gilgit-Baltistan Child Protection Commission was notified, the oversight body for GBCPRA 2017. At the provincial level, a technical working group TWG was formed with representatives from different departments such as health, education, law, labour, local government, police, prosecution, as well as UN sister organizations, civil society and other partners to steer the implementation of GBCPRA 2017. At district level, district child protection committees being made functional for better coordination, headed by the district commissioner with representation from education, health, police, labour, local government, among others. Thus, an entire institutional child protection governance structure has been set up, running from territory level down to the local level, with the aim to bridge between the formal and informal structures, which is key to reach every child in need of protection. A child protection policy, data protection, and confidentiality policy and child safeguarding policy has also been developed as guiding framework. To ensure an evidence-based design, a mapping and assessment exercise was undertaken to assess the institutional, organizational and individual capacities of the key stakeholders. The assessment findings informed the development of the technical package on child protection case management and referral system, and the communication package validated by the TWG in October 2019 and stand approved by the CPC. The Child Protection Case Management and Referral System technical package includes overview of child protection case management and referral system, Organizational Structure and Functions Manual, Reference Manual for Case Managers, Handbook with all the forms, guidelines, SOPs, Helpline Guidelines, Training Manual, Monitoring Framework, Interdepartmental Coordination Protocols. Similarly, the communication package includes Communication Strategy, Communication Structure and Functions Manual, Reference Manual for Communication Workforce, Communication Training Manual. For the first time ever in the history of Gilgit-Baltistan, a dedicated cadre of child protection officers, both males and females, have been appointed by the Government of Gilgit-Baltistan, and public funds have been allocated for the delivery of child protection. A training of trainers on child protection, case management and referral system, and communication for social service workforce, including representatives from collaborative departments, was successfully completed in November of 2019. COVID-19 pandemic unfortunately led to multiple challenges on ground right after the training. However, Government of Gilgit-Baltistan, with UNICEF's technical support, continue to maintain the momentum by engaging the workforce through mentoring, establishing the 1121 helpline, and moving efforts to operationalize the design and workforce. A Model District Child Protection Unit (DCPU) has been established and inaugurated in Gilgit on 17th of August 2022 as a one-stop center to provide protective services to children in need of protection. The DCPU is in close proximity of the police station, hospital and court to allow for quick service delivery and linkages. DCPU is providing protection services to children through an integrated child protection, case management and referral system, where services are brought to a child in need of protection under one roof. The process begins with identifying and reporting a child abuse case through the helpline or visiting the DCPU by any of the gatekeepers, including from health, police, labor inspectors, teachers, community members, children or their families. An eligible case is registered whereby a child in need of protection by law is defined as any child who has faced physical violence or injury, mental violence, sexual abuse or sexual exploitation, including child marriage, forced marriage, child trafficking, child prostitution, online exploitation. Exploitation, including child labor, neglect or negligent treatment, physical neglect, failure to provide basic necessities, psychological neglect, including drug abuse, mental health neglect, educational neglect, or maltreatment. This is followed by initial and comprehensive assessment to help identify protective services a child may need. Only then, a case plan is developed in consultation with the child and his or her parents, guardian, caregiver. The case plan is then set into motion and referred to collaborative departments for services such as legal aid, mental health and psychosocial support, alternative care, among others. Each case is monitored through follow-up and case reviews. A case is closed only when all services, as per case plan, have been provided to the child in need of protection. Similarly, prevention interventions and awareness raising through participatory methods with children have also been initiated through the recently signed MOU between SWD and GPRSP. In July of 2022, 21 social mobilizers were trained to deliver the promotion and prevention services. As the program enters into the implementation phase, UNICEF continues to support supervision of the model through regular mentoring and monitoring. COVID-19 pandemic has unfortunately witnessed an upturn in the child abuse cases in Pakistan and calls for even a more strengthened child protection response on ground, for which Government of Gilgit-Baltistan and UNICEF remain fully committed. Alongside an integrated child protection IMS has been designed with support from Technology for People initiative at the LUMS University. The CPIMS will actually allow the social service workforce to report, manage, refer and record the cases online with minimum effort. UNICEF's globally tested open source platform Primero has been used to adapt the CPIMS for Gilgit-Baltistan. Age and gender disaggregated data will help monitor results for children in need of protection. As the journey unfolds, other provinces and territories in Pakistan continue to make progress, as well as to strengthen their child protective systems and deliver results for the protection of children. Alone, we can do so little. Together, we can do so much to protect our children from abuse.